Welcome to Voices of Care. Coming up in this episode, my conversation with Philip Luce, CEO at Bupa Cromwell. We'll be talking about the role of the independent acute sector and its bounce back from the COVID period.
There's been, a very significant increase in patients who are looking to self-fund their care. We've certainly tried to make it as easy as we possibly can. Retention is incredibly important to us as a hospital. We have many people who have worked in the hospital for very many years, and having that sense of community, I think, really helps drive great patient experience and outcomes. It's really important that as a hospital we continue to innovate and we continue to adopt new technology. Patients expect it. There is a real opportunity for the independent sector to work alongside and complement what the NHS does.
Hello, I'm Suhail Mirza and welcome to this episode in Season 2 of our Voices of Care podcast. I'm joined today by Philip Luce, CEO at Bupa Cromwell Hospital. The Voices of Care podcast seeks to get to the heart of the issues facing the health and social care sector, and by understanding how we can enable the healthcare workforce of the future. In this episode, we're going to be talking about the independent acute sector, its bounce back from the COVID period, new entrants to the market, the fierce competition for workforce, and the potentially expanded role for the sector in light of the government's elective task force recovery report. A lot to unpack there, and who better to talk to than Philip? So thank you very much for joining us today and giving us your time.
Thank you, Suhail. It's an absolute pleasure to be here. Really looking forward to it.
The privilege is ours. Before we get into the depth of these various questions, I wanted to give you the opportunity to give. Bupa Cromwell is an iconic hospital, very, very well known. Perhaps you've been there since 2017, an earlier stint prior to that. Perhaps you can just paint a bit of a picture about the work of the hospital. It's renowned internationally, of course.
Yeah, absolutely. I think I'm very proud to work and be a leader at the Bupa Cromwell Hospital, and we're a hospital which really does a number of things. First of all, it's a hospital for the local community of Kensington and Chelsea, and we're very lucky to provide both adult and children's services, which means we can provide a lot of the necessary care to the local community, and that ranges from things such as primary care, orthopedics, dermatology, etc., services like that. But we also focus very much on managing patients who have very complex medical and surgical needs. So our strategy focuses a lot on cancer, and that ranges from being able to provide chemotherapy on site, meeting the surgical needs of cancer patients, but also managing medical patients in the ward. And we have our partnership with Genesis Care to provide radiotherapy as well. And also a lot of focus on cardiothoracic surgery and liver and renal program as well. So, as a hospital, we treat patients who are insured with UK insurance, of course work very closely with Bupa, but we also treat patients who are self-funding and have a very large number of patients who travel from international markets to access our very specialist services that we offer.
140 countries, I think, last time I looked. Might be more now.
A little bit more. I think 164 is the latest count. So again, something we're really proud of to have such a rich and diverse group of patients seeking our skills.
Absolutely. Now, the sector itself, the independent acute sector, obviously had a challenging time and an important role during COVID. Lang Buisson's Healthcare Market Review, published earlier this year in 2023, talks about the sector bouncing back and saying, and I quote, demand at historically high levels across all the sectors, pay groups you've talked about. What are you seeing? So it really is a buoyant time for the sector as a whole?
Yeah, absolutely. That's our experience as well. Throughout the pandemic, we worked very closely with the NHS and worked as part of the Royal Marsden Time Critical Cancer Hub, and we're, again, really proud to be able to perform the cancer surgery that we did. Post-pandemic, I think there have been three areas of recovery. First of all, has been the international patient activity as travel restrictions were released, I think, in kind of towards the tail end of 2022. I think that's right. We very quickly saw patients who hadn't been able to travel to the UK, travelling back to the UK, and that recovery happened and was really very significant. Next, we saw an increase in UK insured patients seeking out care within our hospital, and that took a little bit of a little bit longer to recover. I think in part because patients were working from home, and so they, with the exception of those who lived and were relatively close to the hospital, others were potentially accessing care elsewhere. And when I look more specifically our diagnostic centre that we have in the city, Basinghall, it's really this year that we've seen a full recovery, and that's now back to pre-pandemic levels of activity, as many people are now working back in the city, and I think having this hybrid model has really helped with that. And then, of course, there's been a very significant increase in patients who are looking to self-fund their care, we've certainly tried to make it as easy as we possibly can for patients to access the hospital. Whether that be through education, pulling together different packages of care, providing options for patients to be able to self-fund, whether that be through finance or fixed packages where they can be really assured that there aren't going to be any unexpected costs by coming to us. But that continues to grow, and I think year on year, if we have seen growth, and if we compare ourselves now to pre-pandemic, it's around 30% busier than we were. So
a buoyant picture indeed, and actually the buoyancy of this market and London as a hub, of course, for international clients has led to a significant increase in competition. We've seen some new entrants to the market here, Cleveland Clinic perhaps being the most ubiquitous. We've seen acquisition activity taking place. So there's of course the $64 million question here will be, of course, you're still searching for staff, clinicians, non-clinical staff. It's well known the NHS, of course, have tremendous shortages, tremendous competition. Are you seeing that with the new entrants? I guess that must be a factor that you put into your business plans.
Yeah, look, when new capacity opens, there's clearly going to be an increase in the demand for healthcare professionals, and it's a relatively small pool of very specialised people. But I don't think it's just about the new entrants coming into the market and that increased capacity that we've seen. I think it's been multifactorial, actually. I think post-pandemic there had been a period of time when many people had stayed incredibly loyal to their employer. They'd supported through the pandemic. They wanted to stay in their role and to help and care for really sick patients at a very critical time. And I think post-pandemic, it was very much expected that the jobs market would become buoyant and people would look for changes who may have otherwise looked for new opportunities over that kind of previous 18 months. So I think that's one factor. There are less European nurses now registering to work as nurses in the UK. And I know, at the Cromwell we have lots of international patients, but we also had lots of international staff working at the hospital. And we certainly have far less European nurses now than we did beforehand. So that's a contributing factor. And then on top of that, you have the increased capacity. And I think, that's just, it did make the recruitment market a little bit more challenging. We've worked incredibly hard, both at Bupa, and within the Cromwell Hospital, to try and attract the right clinical and non-clinical specialists into the hospital. We've seen, huge success in that. We developed an international recruitment program, and we've been able to attract a lot of nurses into the UK through that. And actually, we're in a really good position now, and importantly, we've seen our attrition fall steadily over the past 18 months as well, and that's now running at around 8%, which is actually very good in the sector, and something that again, we're really proud of.
No, that's absolutely encouraging. I think you've talked about the idea that obviously patients, particularly now, more self-funding for a variety of reasons, including the waiting lists, of course, in the NHS being a factor in that. And we've seen perhaps beginning to see a sea change in terms of the acceptance of independent acute sector. There's usually a narrative in terms of favouring the NHS, but the independent sector has played a very important role. I wanted to emphasise the importance that you, the Cromwell, place on safety, transparency, data, information. This has been a trend that's been important within the independent acute sector. The work of Finn, of course, you'd be familiar with. I think you've been dealing with them right from the beginning in 2016. So can you expand upon how important that is to you and what's the measures you're taking to assure that actually the level of care is world-class and on a par with anything else in the system?
Yeah, I mean, absolutely. I mean, Bupa has an ambition to, to be a world leader in being customer centric, and in terms of our patient experience, we spend a huge amount of time ensuring that our patients who come into the hospital have the very best possible experience they can. That is, of course, a metric which we can measure. We are, record, as you would expect within the healthcare environment, there is a huge amount of data available to us. And I think one of the roles which Finn is playing is, ensuring that there is real transparency around the data of the consultants, the doctors who are working within the hospital, but also the hospital providers themselves. And, we're delighted that we're able to share the data around, whether it be mortality, whether it be the number of never events, whether it be the number of kind of unplanned transfers out of the hospital. These are all really important data sets which we should share and referrers and patients should have access to. So very much welcome the work that Finn are doing. In addition to that, there are, we have, the gold standard for health and safety, something which we've been awarded 4 years in a row, and that's, very much about providing a safe environment, both for our patients, but also for our staff as well. This year we achieved first place for the PLACE audit, PLACE standing for patient-led assessment of the care environment. It's a voluntary audit. We don't have to go through it, but a team of people come into the hospital. They assess that environment for how dementia friendly we are as a hospital, what the standard of our patient environment is, the food, etc., like that. And we were delighted that we came number one in the UK this year. So lots and lots of data. Of course, patient recorded outcome measures and patient experience measures, PROMs and PREMs, are really important, and we spend a lot of time trying to collect more and more of that data, in part because we want to learn, in part because we want to share the experience that our patients are having and the really good outcomes that we achieve. But I think more transparency and sharing more of that data and it being available through places like Finn is really important.
And that drives the standards and across the sector completely, and helps to place that narrative in perhaps in a different context. And congratulations on the placement, if I can call it that. I wanted to touch upon some of the things you talked about, retention, which is so important, and I wanted to talk about some of the initiatives that you've taken in your vision of 22-23 around inclusivity. You talked about inclusive leadership and inclusion for patients, and your REDI initiative. So can you expand upon that, because it's such an important element in whether it's the NHS or the private sector in terms of retention?
Yeah, of course. And I think just to start with that, retention is incredibly important to us as a hospital, not only because it clearly reduces cost and but it provides a real sense of community in the hospital. And one thing that I really love doing each and every year that I've been in my post is going to our kind of annual long service recognition and awards. And we have many people who have worked in the hospital for very many years, and having that sense of community, I think, really helps drive great patient experience and outcomes. And of course, as I just mentioned, it reduces cost as well. I think when we look at the standards of care that we deliver, the lower the attrition rate, the less likely you are to have incidents, the less likely you are to have patient complaints as well. So one of the things we focus on in Bupa is having a very high engagement score. 80 is considered world class. And we have a program running called Mission 80, which is where we are aiming to achieve the 80 engagement score. And we've had a 6-point increase over the last two surveys, and we're within touching distance with that. I'm really confident when we run that next survey in November this year, we're going to be able to achieve that. But underpinning that are a whole series of different objectives and kind of things that we're working on. And one of those is as you've mentioned, the READY network. And READY stands for Respect, Equality, Diversity and Inclusion. And it's really important to us as a hospital that we have a workforce and a working environment which is incredibly inclusive, where all people are welcome and actually represents the community of patients that we see at the hospital. And so we set up the READY group 2 or 3 years ago. It's a group that meets regularly, is made up from people around the hospital, both clinical and non-clinical. They join our executive team meetings regularly and kind of talk through some of the opportunities for areas for improvement, some of the initiatives that they would like to introduce. And examples of those kind of initiatives would be introducing a zero tolerance policy for the hospital, so that whether you're a patient, whether you're a carer, a family, a member of staff, or a visiting doctor, there is a zero tolerance of any abuse towards those people, and there is a framework with which how that can be managed. We've introduced some training called active bystander training, whereby it was actually introduced by one of our cardiothoracic surgeons that had been run in an NHS hospital and been really effective, and we've adopted it. So, again, it gives individuals who see potentially abuse, or if there is confrontation happening, it allows them to step in and try and change the dynamic in a safe space. In a safe space, yeah. And again, training around microaggressions. So, we're really, again, delighted with the kind of progress that we've made around the READY network, the work that they've done. We've seen a 24% increase in the ethnicity data that we've been able to collect at the hospital. And, again, I think that's a reflection of the journey that we're on and how people are, seeing we're really focusing on this, and we're, making, some really positive changes.
No, thank you for sharing that, 'cause I think it's highly important. As you say, all the stats and the evidence shows that the more inclusive the culture and the leadership, the better patient outcomes, etc. I think that's well established in the literature. I wanted to go slide at a tangent, but I think it is relevant to the idea of the patient experience and actually the consultant experience and the clinician experience in terms of longevity that you've talked about. And that is the reputation that the hospital has in terms of technological innovation. Politicians of every stripe are now talking about technology as a potential saviour for productivity across the whole healthcare system, which is a very big question. But I wanted to zero in on some of the initiatives that you have established. I think thousands of patients have now, whether it's urology, virology, or knee and hip replacement, there's a lot of innovation that has been going on and continues to go on at the hospital.
Yeah, I think it's really important that as a hospital we continue to innovate and we continue to adopt new technology. Patients expect it and consultants expect it, and we want to attract the leaders in from a consultant perspective, and it's really important that we provide them the right tools to be able to provide the best possible care. if I think back over the last couple of years, the kind of technology that we've invested in, we have a partnership with Genesis Care to provide radiotherapy. We've invested in the VUA MR Linac, and that combines MRI kind of diagnostic capability with the Linac for the delivery of radiotherapy. And what that allows you to do is kind of real term bring those two platforms together, and that can really deliver incredible treatment for patients, especially where they have moving organs. So, if you're treating someone with a lung cancer, for example, and as they breathe in and out, the radiotherapy treatment can change with that. We have been working with Insight to look at 3D modelling. So we could take a kidney CT scan, for example, normally a 2D image, that can be turned into a 3D model. A consultant can have a laptop in theatre alongside them. They can see a tumour that they might be resecting in that 3D model. They can potentially import that into the Da Vinci Xi robot as well. And I think it gives them an extra window to kind of, or extra set of information that they can look at whilst they're doing that operation. Or there are other digital solutions. So we've recently kind of partnered with Vine Health to collect patient data around 4 cancer pathways. We've got a head and neck, hepatobiliary, colorectal, and breast cancer are the pathways that we're working on. And that allows kind of patients to enter real time their experience and their symptoms, and the consultant has access to this data.
When they're away from the hospital?
When they're away from the hospital, yeah. And that allows the consultants to monitor them remotely. It potentially allows them to amend and change their treatment regime post-surgery, or they might be going through a chemotherapy treatment plan. And in some instances it's been necessarily based on the information the consultant's been able to see to bring a patient into hospital, and that early intervention we're really confident will allow us to deliver better outcomes for those patients. And I think in addition to that, over the course of their treatment, we're also going to get the longer term outcome measures. So we're going to be able to see how well they've responded to that treatment and what benefits that they've had. And those kind of things have existed for a long time for joint replacement, for example, and the data is widely available through the National Joint Registry for that. But for cancer, and very key to our strategy, is something we're really excited about, and very much expect to roll out to more tumours. I think the last thing I would just say on that is, when we use paper, it can be sometimes quite difficult to engage patients, but in our kind of early pilot with Vine Health, we had nearly 84% of patients who are using it are engaging and in regular communication with our consultants and clinical nurse specialists, which is just incredible.
Now, that's an incredible stat, and I guess it also gives, from a broader patient journey perspective, agency and autonomy to the patient, almost co-creating the plans in one sense in real time.
Yeah, absolutely. Couldn't agree more. They genuinely feel part of their treatment plan. Yeah, it's really exciting.
No, very much. I think that the whole sector should look at that. One penultimate question before we look at the broader perspective and the role of the independent sector in the future, and this is on training and development pathways. The NHS People Plan, Workforce Plan has come out. There's some broad changes over the next 15 years, but zeroing in on the work that you do. You've talked about retention and longevity for many of your workforce. Is there a key element where training and development and career aspirations plays a big part? Because I think it's not just a question of having the right clinicians or non-clinician expertise, but also giving them the opportunity to train and develop their multidisciplinary or specialist skills.
Yeah, I mean, as a hospital, and when we look at retention, we look at training and development, and it's really important to us. I think being part of Bupa presents us as a hospital a huge opportunity. I myself have had a role at the Cromwell. I then moved over to a health and dental clinics business before coming back into the Cromwell. And if I look around our executive team, and if I look at some of the senior leadership team, many of those people have started in clinical roles, and then they've worked through different leadership roles to end up in those more senior roles. So being part of Bupa presents us, quite a unique, but I think really exciting opportunities to develop our staff. But of course, there are many people who want to develop as clinicians and remain as clinicians. And this year we've introduced our kind of nurse pay and career progression framework, and that's something which we rolled out in April this year, and has been really well received. We've very recently introduced the nurse apprenticeship role as well. I think it's it's really important as a hospital that we present as many opportunities to our workforce as possible to progress through their career, and also to adopt and to learn new skills across different specialities, and it's something which we know is really important in retaining our staff.
And also, as you say, from the leadership team, with the benefit of the Bupa structure, you've got obviously the chance to pick up expertise in many different subsectors. One final question I really wanted to get your experience on, and given your expertise, we've had the government's Elective Recovery Task Force report come out this year in 2023, and we don't need to go into the detail of it, but the principle is it definitely envisages a broader, more expansive role for the independent sector across all of the healthcare landscape. And I just wanted to step back. The independent sector played a vital role in at the height of the COVID pandemic. It's a buoyant sector you've talked about today. What do you see in the immediate future? A greater acceptance of the fact that this is a vital part of the healthcare landscape, and to perhaps change the narrative around that?
Yeah, I mean, as a hospital, as you mentioned, throughout the pandemic, we worked incredibly hard, and I genuinely believe we played a really important role in supporting the NHS, especially around time-critical cancer surgery. And actually, since the pandemic, we've continued to do that. So more recently, at our diagnostic centre in the city, we've been providing capacity on our MRI scanner, and also to some of our cardiology outpatient testing. Over at the Cromwell Hospital, we're currently doing some NHS long wait surgery for head and neck cancer patients, and we've also done some endocrine cancer for patients who are on a wait list as well. I think there is a real opportunity for the independent sector to work alongside and complement what the NHS does. And clearly within a hospital setting such as the Cromwell, we're able to manage patients with very complex medical and surgical needs. So we're very well placed to support and provide that environment where needed. We are very happy to support where appropriate, and if we are asked, we will always look, and assuming we have the capacity, then we will absolutely help.
So I think the spirit of collaboration is very, very strong and welcome within the landscape of the healthcare sector.
Yeah, absolutely.
On that positive note, Philip, thank you so much for your time and your wisdom, and coming and joining us today.
No, absolute pleasure. Thank you for having me.
My pleasure. If you've enjoyed this episode of Voices of Care, please like, follow or subscribe wherever you receive your podcasts. And if you want to understand how we are truly enabling the healthcare workforce of the future, please visit newcrosshealthcare.com/Voices of Care. In the meantime, I'm Suhail Mirza. Thank you very much, and look forward to seeing you on the next episode.